So, welcome to Samir Critic. So, as per previous talk, we will continue with our another prosthesis, which is known as spinal prosthesis. So, in case of spinal prosthesis, we have three kind of prosthesis. One is screw based, another one is disc based, and another is plate based. So these kind of fixtures we are basically used in case of spinal cord prosthesis. So we will definitely going through one by one uh, in brief way. So in case of screw fixation, there is less number of degree of freedom in between two vertebrae. Then comes under disc and plate. So today we will not discuss those things elaborately because of limited time. So in the upcoming days we will make a session only on spinal prosthesis as well. So there we will much more discuss regarding the spinal prosthesis and how those means how the degree of freedom we can increase using that plate fixation rather than screw fixation. So also one thing we will discuss here, the this is the modern technology. So whenever any broken end we get any kind of spinal cord, so two vertebrae are discontinued, then we will make such kind of arrangement like a vascular graft, and there we will place the scaffold, the seeded cell, and the growth factor, so that the broken zone of the spinal cord will be formed with the new tissue, and there is no such kind of without any kind of fixation or any kind of autograft or xenograft. We can make that, we can heal that broken spinal cord. So now comes to the elbow prosthesis. So this is basically from the same kind of knee joint prosthesis. Yeah, so in case of elbow prosthesis, there are two part as well. So in between there we are using the metallic screw or the fixation, and there is also a two part like hip prosthesis. One is complete elbow joint replacement, another is only the upper part of the lower part of the elbow prosthesis. So those we will be again discuss in the upcoming days as well. So now come to the stents. So in case of cardiovascular, this is very much using this kind of stent we are very much using. So previously those are basically made up of metal or stainless steel, but nowadays we are basically going through the polymeric materials to make ourselves vascular, to make those things, so make those cardiovascular strength as well. So now comes to the how the material consideration or material point of view, how the stent has been classified. So first is the bare metal stents. So this is the basically made up of stainless steel, cobalt, chromium alloy, platinum alloy, and those all. And second is the bioreabsorbable stains. So bioreabsorbable stains are basically made up of polymer like polylactic acid, polydilactic acid, and so on. Also some metal based alloy like magnesium, iron, and iron zinc alloy are used simultaneously. Again from the and again we are using very much latest stain technology like drag eluting stains. So these are the first generation and second generation as well. So in case in under first generation drag eluting stains are the drag of sirolimus as well as metallic platform or metallic point of view 316 SS as well. In case of second generation, drag uh, Limas. So just know that name, that in case of drug eluting stains we are using from metallic point of view as well as some kind of drug eluted into that stent. So so this is about that drug eluting stents. So what are the advantage of stent? Stent in the primitive state guided to a region of the blood clot inside the arteries via the catheter wire. So stent expansion via the balloon inflation. Balloon tripped the catheter and removed and expand stent restored it normal blood flow. So basically whenever a blood clot around in the arteries form, so we have to use those stents. So before basically we are going through the balloon angioplasty. So after stent, so we are using those as well, so that long term it will we can place it into that part, and so that the after implantation there should be no chance of blood clotting in future as well. So now come to the artificial arteries or veins. So in case of artificial arteries, we are using this kind of mechanism. So collagen tube kind of things we have used for designing artificial arteries or veins as well. Now comes to the heart valve. So designing of a heart valve first comes into the picture around 90s. So those the heart valve I have shown here is the TTK heart valve. So there is a disc, another is the swinging ring, and another is frame. So frame are basically made up of metallic materials. So this is where the strength of the materials is very high. Another thing is the disc. So disc is basically made up of soft material which is ultra high molecular weight polyethylene, and the swinging rings is made up of knitted polyethylene or the polyethylene terephthalate fabric as well. So we can read it as PET. PET polymer has used here. So now comes to the tooth implant. So tooth implant are also classified as screw based and the bridge implant. So in case of screw based, basically we are focusing on particularly on tooth, only one teeth. But if number of teeth has been means dislocated due to the accidental or any other damage, so we are going through the uh, uh, bridge support for this oral or dental implant. And now comes to the artificial skin. So in case of artificial skin, we have decided that what is the like when we are going for skin grafting, basically for burning the wound, but some accidental damage or the wound, what it can for that the wound is coming out. So basically in case of skin you have to think that how much in the how much burn or the wound has been taken place. So if it is means only the first layer of the skin, then we will going through the any kind of uh, so any kind of we don't going through any kind of skin grafting. But it is if the wound is third degree, like the third degree burn, or any case of that more layer of the skin has damage due to that accident, then we will going for the skin grafting. So this is the skin inspired electronics element polymer chemistry. So in that case we are basically use this kind of process where the stretchable and elastic things is replaced and so on and so on. And also the skin replacement are basically previously it was by epicell skin replacement. So this is the previous talk. So in 1987 this kind of skin replacement was taking place, but right now the most and important skin replacement is done by the integra dermal regeneration templates. So this is the first and only FDA approved tissue engineering product for burn and reconstructive surgery. Please keep it in mind. So this is a bilayer membrane system. So not one layer part. And in case of epicell skin replacement, there is a grow that cell is about 2 to 3 weeks and allow them in front of individual seat of the tissue. So coming to the conclusion part, so we have basically going through the every kind of implant process, most kind of implant process except the uh, cochlear implant and some kind of load bearing implant as well. So but discussing with the brief discussion about the like knee joint, hip joint, as well as skin, as well as cardiovascular application of cardiovascular biomaterial application on the cardiovascular zone. So we can say that the biomaterials are very much emerging is in today's field. So biomaterial can optimize but the research also needed to modification of biomaterial to optimize the cellular adhesion, and also the increase of bioactivity in the biomaterials, so that the bio reabsorption will take place after implantation. So this should be kept in mind. And also we have to going through that the patterning technique have allowed to control over the adhesion domain inclusion on the surface and the biomaterials in the micro and macro nanoscale level, optimizing the biomaterial design to mimic the native adhesion interaction to the cell population, provide a method for controlling downstream cell responses, and could have significant impact for therapeutic application as well. So that is all about the basic application zone of the biomaterials. So next class we will discuss about the failure and the corrosion, basically the corrosional techniques that we have to take in care after implantation, because corrosion is the mule corrosion and the other chemical factor, those are mostly responsible for failure of the implant. So that will be discussed in the later class. So thank you, thanks for today, thank